Kimberly Crawford, Ernie Zuniga, Sean Stevens. This is San Antonio's Fox News First.
Welcome back. It is 7:10, and earlier in the week we showed you a new procedure for varicose veins. We talked to Dr. Silva with the Interventional Radiology Clinic. He performed a procedure on his patient, Don Finch. Now let's take a look at what Don's leg looked like before. Let's see if you remember this. Roll that beautiful footage. There it is. There it is. That is his varicose vein. Talk about painful. It was causing him a lot of discomfort. But a new procedure was performed. It's called endovenous laser treatment. Dr. Silva did this. Now look at Don's leg only, a week later, Dr. Silva. Let's take a look at his leg now. Look at that. That is amazing. Dr. Silva is here along with Don. And, okay, again, how is this procedure different from, you know, those of the past?
The traditional treatment has been a vein stripping and ligation. It's a surgical procedure that typically involved weeks of recovery. And interestingly, Don actually had that on more severe disease in his left leg.
On the other leg.
Correct. And now Don is an interesting comparison because I've done my treatment on his right leg. And as you can see, the visual benefits are already significant. And he's also shown medical benefit. His legs feel better and the recovery is minimal.
Right. And Don, I know you said that that leg was so painful. I mean, at night you would have to elevate it after being on it all day. And, I mean, tell me about the experience. I mean, what's it like now?
It's been a major improvement. And as you stated, you know, with a lot of folks with this affliction, when you take the load off at the end of the day, the swelling and the pain can be almost unbearable. So it's been a huge improvement.
Wow. So tell me briefly, if you could explain what you did and why it's different, because I know it uses a laser.
Correct. We actually put a laser into the vein, and it's with that laser that we burned the vein closed and did away with the blood that was flowing in the wrong direction back towards his foot and feeding that varicose vein. By doing away with that blood flow, we treated the varicose vein, and we actually did small dissections to remove the veins shortly thereafter.
There's not even much bruising. That's just incredible.
Minimal.
And you actually walked out after the surgery. You were up and walking.
It was an in and out procedure, and I was on my feet right after the procedure.
Amazing. And I mean, I know there are other doctors that offer this, but not a whole lot of places can do this procedure. So it's fairly new.
Correct. Community awareness for this condition is key, and the benefits are obvious. And that's what interventional radiologists do, is minimally invasive treatments.
Let's give everyone the information if they want to call you, if they are struggling with those varicose veins, again, in pain, because I know it is very uncomfortable. The number is 210-616-7780, and that is to the Interventional Radiology Clinic, where they can find you, Dr. Silva.
Thank you.
Thank you both for being here. Don, you look great.
Thanks, I appreciate that.
And would you recommend this for anyone suffering from what you were?
Absolutely. With a lot of folks out there may not know that there are treatment options out there that are fairly affordable, so I would absolutely recommend this to
And
them.
Insurance does cover it. I should tell everyone, you had said most insurances do cover this
including
procedure.
Medicare, yes.
Okay, well see, doesn't get any better than that. Thank you both for being here.
Thanks for
Have
having
a great weekend.